officials are also concerned about the growing number of COVID-19 cases in students.
WCCO's Liz Collin shares what happened when one teenager tested positive this summer and what it meant for the rest of his family.
A week after that, I started getting like a sore throat and some symptoms.
For Michael Berry, it was as simple as playing a video game with a friend this summer that led to his positive COVID-19 results on August 6th.
I was just super tired during the day, a little bit of a headache when I would get up and stuff.
The ninth grader's symptoms were fairly mild and over in about a week. Despite Michael's relegation to the basement, the rest of his family eventually got sick, again all with minor symptoms. But with school now back in session and sports getting the green light, it's the young people Minnesota's Department of Health worries about most for the ripple effect it could cause.
We're very concerned that with the high rate of transmission that we're seeing, that it won't be too much longer until we really have difficult decisions to make.
Take a look at the case numbers since the start of fall term at Minnesota State colleges. 670 among students and 49 among campus employees. A broader look at some of the biggest universities show the most cases at Winona State, Mankato State, and at the U of M. The highest number of positive cases are among those 20 to 24 in the state. One death in that age range has been reported, while 38 ICU hospitalizations have been among those 10 to 19. The real worry is younger people passing the virus to an older and more vulnerable population.
We are extremely concerned, and this really is a time for all of us to work together.
Liz Collin, WCCO 4 News.
MDH continues to remind people of a layered protection plan from masks to social distancing and avoiding crowds. Health officials are also working with schools to decide which learning model is best by monitoring the number of students and staff who test positive and the percentage of both who could be out of school due to any exposure to COVID-19. The New York Times created a list of metro areas dealing with the most new cases of COVID-19 based on population. No Minnesota cities rank in the top 20, but 5 are in Wisconsin. La Crosse ranks #1 on their list, right on the Minnesota border. The Times also listed areas where cases are rising the fastest. Winona ranks 11th on that list, and 6 Wisconsin areas are also included.